Hi, everybody. So I wanted to record your lectures and give you about 15 minutes of me talking over the PowerPoint so that you have a clear idea of examples of what I'm talking about. And just let me know if you like these recordings and these videos attached, and I will continue to do them. So this week we're talking about community and public health. This does align with chapter 1 in your book. And just so you know, the book is an introduction to community and public health. That's the 9th edition, and it's by Mackenzie. Mackenzie is an author that does a lot of work in community program development. So he works a lot with health programs. Okay. So what is a community anyway? So you're probably thinking about the community in which you live. If you're in the area, you're thinking about Buffalo, right? But it's not just geography. We often define a community by just strictly latitude, longitude, but that's not the way it works. A community in public health eyes is really any shared interest group. It could be a collective body of individuals that have a similar experience, they have similar concerns, they have similar values. So a community goes a lot deeper than just your geography. Maybe they're all working towards something. Right? So what characterizes a community? So it could potentially be membership. It gives you a sense of identity and belonging. So you think about your community, maybe you live in a certain village or a certain town. Your membership to that village or town allows you to say, this is my community, right? I live in the village of Kenmore, for example. So when they're running some sort of event, I say my village, right? It gives me a sense of belonging. Common symbol systems. So this goes as kind of straightforward as language to rituals to ceremonies, and you kind of may think of these they may come to mind pretty naturally, but similar language, it's very important that everyone in your community speaks the same language that you do, right? If everyone around you spoke Spanish and you spoke English, it would be a little hard to feel as though you belong in that community. Shared values and norms. So this one, you probably, again, take for granted that what you do is considered normal, and that's why you do it. Right? So if you were to walk down the street on your hands in a handstand, that would not be considered normal, right? People may question you. They may ask you if you're okay after a while, right? So walking down the street on your feet is a very normal thing to do. People value that. It looks good, right? So you may take it for granted, but everybody in your community typically falls within a range of shared values and norms, and that's respected. Mutual influence. So it's important to remember that members within a community influence each other. Okay, so members are influenced by those around them, and they also influence others. Okay, so if you want to think about this in terms of government and the people that they're serving, you may think of the government, setting a law. But if the people don't like that law or rule, then they speak with the government. Maybe they have some sort of uprising, or maybe they boycott that law or rule, and they also influence the government. So it's that relationship, that give and take, that makes a good community. Shared needs and commitment to meeting them. Okay, if you had a community where each person, each individual had a different goal, they would not get very far, right? So if you have all individuals who value the fact that people are safe on the roads, now you get speed limits, now you get stop signs, now you get speed bumps, now you get lights, right? So if you had 3 people who valued being safe on the road, 4 people who didn't care, 2 people who wanted to absolutely go crazy on the road, right? And that was your whole community. It may be very difficult in order to make a commitment and meet it. Shared emotional connection, okay? So this again goes a little deeper than a community geographically. This is the history that people have been through, how they support each other through that, how their experience allows them to connect with each other and to really share a strong bond in order to reach a goal together. All right, so consider all the communities you belong to. And just to give you an example, a list of my own is below. So geographically, I am in the village of Kenmore. Professional affiliations, I'm part of the union of ECC, the National Strength and Conditioning Association, the American College of Sports Medicine, and then something a little different at the bottom, all of those who are paying back their student loans. So I'm a member of this community, and we all have this lofty goal of paying back our student loans as soon as possible. And I think that we all, talk to each other, we relate to each other, and we share tips with each other. So it's like a little community that we have. All right, so that's just outlining. It's more than geography. It really is age, interest, professional skills, maybe certain outcomes that you have. Right? Defining the health of a group. So how do you actually talk about how a certain group of individuals are doing? And in order to do that, there are 4 terms that you have to understand how they're similar and how they're different, because if you go in the literature, you're going to hear these terms used interchangeably by professionals in the field, but also lay people who don't work in the field. So you may hear aunts, uncles, individuals, if they aren't part of the public health field, they may say, globally, public health is ruined, and it's a little bit of a generalization, right? Those 2 terms are very different. All right, so public health. Public health is probably the most inclusive of the terms. And really meaning it's general and it's used quite often. The Institute of Medicine defines it as what we as a society do collectively to assure the conditions in which people can be healthy. Okay, so you really have a society of individuals making sure that there are conditions set forth that keep the population healthy. And then, of course, how do you keep the population healthy? You have your public health system. So you have all these activities that are undertaken by formal structures of government, but not just government. It's easy to think that the public health system is all government, and it's not. You also have nonprofits, you have voluntary organizations, you have private health organizations, and they're all coming together in order to assist public health. So just make sure when you're talking about public health, you're not just thinking maybe the state public health system, right? It could be kind of trickling down into just a nonprofit in your own community. All right, community health. The health status of a group of people and the actions to promote, preserve, and protect their health. Okay, pretty similar. This one, this one and the next one you'll notice very similar. This is a little bit more of an older term compared to population health. Population health is the health outcomes of a group of individuals, including the distribution of outcomes within the group. So what are outcomes? Outcomes are things that maybe a group they were exposed to. I guess it's a great way of saying it. So it could be something bad, right? It could be something like cancer. That could be an outcome. It could be something like accidents. Usually when you're thinking about population health, you're thinking about things that are affecting other people or a group of people, okay? Global health. Now, obviously, when you think of global health, you're thinking of health that spans further than just the United States. And I know one of the examples that popped up in my head, because I traveled to Puerto Rico for my honeymoon, was the Zika virus. So when you have a virus that's someplace that people are traveling and it is communicable, right, or it is spread by a parasite that could possibly be transported with that person, or they could be affected. I know the maternal health could be affected, the baby could be affected. You end up with a global health problem. And this is where you start to see like the Center for Disease Control. You start to see the World Health Organization. And if you're not familiar with those groups of people, I suggest that you look at their websites now. They're leading groups that really make sure that the world is on the right track in making sure that they prioritize the health issues the right way. So global health really are these health problems, these issues and concerns that transcend national boundaries, and you really need cooperative action. These organizations like WHO, right, and the CDC, they cause this cooperative action to occur and for nations to put aside their differences and talk about what's actually happening health-wise. All right, so factors that affect a community, okay? You have physical factors, right? This could be geography, it could be a mountain, it could be a industrial development site, kind of plop down right in the middle of your community. You have social or cultural factors. This could be, I think of the difference between living in the country and living in the city. Okay, that urban environment, that city environment is going to have a very fast-paced life. So you may have individuals who are much more stressed out in a city environment. Community organization, this one is really important, and I think we take for granted how our communities take the time to organize themselves. If your community is not organized, you are not going to be able to address any health issue that comes your way. So you need to be able to take all your resources and put them into action. And then, of course, individual behaviors. So remember that each person of your community is part of the whole, and their individual actions count. Okay, so talking a little bit more about community organizing. Your community needs to be able to identify what the problem is, which sounds easy, but sometimes you don't know what problem to focus on, right? So you have to decide what problem is the priority, mobilize your resources to correct that issue or ensure that you, if you can't correct it, maybe you isolate it. And then you develop and implement strategies to long-term make sure that your population is safe. Okay, and that's like a super simple outline of how to organize a community, but you could write a whole book or 500 books on how to organize different types of communities. All right, and then there's this concept of herd immunity. Okay, so I put a herd of buffalo here, and why do animals herd? Okay, it's to protect themselves, right? So the individual behavior in a community contributes to the health of the entire community. Okay? It takes the effort of most individuals in the community to make the bigger concept or to change the public health problem. Right? So together, working as a group or as a herd, they can be immune to the problem versus just one person trying to make a difference. So if you have an individual who has decided to start shopping locally, maybe using a farmer's market and buying all their things organic, and their health starts to improve, then that person is going to be healthier. But if the whole community does not change, or most of the community does not change, the population of the community is not going to be affected. So you have to get everybody on board. So really, as you're going through this course, think about all the different types of individuals in a community and how they're all going to interact in such different ways to really affect the health of the community. Okay, so we'll talk a lot about it. I'll have you reflect on it and just think about you yourself, how you affect your own community. All right, so next slide. Next PowerPoint you'll see is going to be on a different chapter, and this one is chapter 1. Thanks.